Good morning and welcome to Bright News Network. It's Saturday, July 18th, 2026. Let's get into it. First up, a backyard plant could be a game changer in the fight against malaria. Researchers from Wales and Uganda have found that a lotion made from homegrown catnip is just as effective as DEET at repelling mosquitoes in rural Uganda. The findings were presented at an international science conference in Florence, Italy. Because catnip can be grown locally at low cost, this natural solution could reduce dependence on malaria medication, especially important as the parasite grows more resistant to existing drugs. Sometimes, the best medicine grows right outside your door. Next, meet the most adorable firefighters in Europe. While a recent heat dome sparked wildfires across Spain, one national park stayed completely unscathed, and its secret is a herd of grazing donkeys. Doñana National Park hasn't had a single wildfire in 9 years, thanks to these steady, hard-working animals keeping the grass and dry vegetation naturally trimmed. No expensive machinery, no chemicals, just donkeys doing what donkeys do best. It's a beautifully simple reminder that working with nature is often smarter than working against it. Here's some big news for our oceans. Bloomberg Philanthropies has pledged a remarkable $260 million to help turn the United Nations High Seas Treaty into real, on-the-ground protection for the world's oceans. The organization identified a critical funding gap. Many countries had signed onto the treaty, but lacked the resources to actually implement it. This donation aims to bridge that gap and ensure that promises made on paper become meaningful action beneath the waves. When historic agreements are backed by serious investment, that's when real change becomes possible. And finally, a story about the healing power of food. About a dozen U.S. states are now offering medically tailored meals to Medicaid patients living with chronic conditions like diabetes and heart disease, and the results are striking. A new study confirms these programs significantly improve health outcomes for participants. The idea is simple but powerful. Food really is medicine. When people receive meals specifically designed for their health needs, their bodies respond. This is healthcare that meets people where they are, and the evidence says it's working. That's your dose of good news for today. If these stories lifted your morning, hit subscribe. We'll see you tomorrow. Now go make some good news today.